Hello, it's great to be in Dublin for the All-Ireland Maternity and Midwifery Festival. In the next half hour, we'll look at the development and foundations of the NMC Standards of Proficiency for Midwives, and where one of the key themes, safety in all its forms, sits within the standards. These standards had a long gestation of over 2 years. They were reviewed and updated as part of a 6-year project looking at our standards for education across nursing and midwifery. For some of the suite of standards, it was well over a decade since they'd been reviewed. Our aim for the standards was that they reflect what the public can expect midwives to know and be able to do in order to deliver safe, effective, respectful, kind, compassionate, person-centred care. Underpinning that statement is the engagement with stakeholders, co-production and planning. Together we worked through the evidence, the demographics, the lessons and the national policy. Each bit of the suite of standards had a project lead, and for midwifery, Professor Gwendolyn Bradshaw of the University of Bradford led the development of the programme standards, and Professor Mary Renfrew of the University of Dundee led the developments of the standards of proficiency. Looking at the structure of the standards, part 1 is the standards framework for everybody. Part 2 is the standards for student supervision and assessment, also for everyone. And part 3 covers the specific programme standards. And then we have the standards of proficiency for midwives and nurses. This means that the ones that are particularly relevant to midwives and students are part 2, the standards for student supervision and assessment. Part 3, the standards for pre-registration midwifery programmes, and in particular, the standards of proficiency for midwives. It's also worth saying that while this is very targeted at students for a lot of it, the standards of proficiency are not just for students and educationalists planning and developing the curriculum. They're for midwives in practice, wherever that may be, and are useful when thinking about continuous professional development, working with students, career planning, revalidation, practice, and service development. On the second slide, we've noted the changing demographics, the social determinants of health, and the lessons from key reports, strategies, policies, and crucially, the existing, new, and emerging evidence. Mary Renfrew had convened a thought leadership group, or TLG, and this slide is a snapshot of the types of policies, reports, papers, and evidence that we took into account at the time. Now, you may be wondering why I've put COVID in there, but I've put COVID in there really to illustrate the point that when we were thinking through the governance and the design principles for the standards, we wanted them to be high level and outcome focused so that flexibility was built in to allow for emerging evidence, new research findings, and anything else coming over the horizon that might affect midwifery. Little did we think. You'll also note that this picks up on both the national and global picture. I've put this picture in because when we launched these midwifery standards in early 2020, I have a distinct memory of standing on a podium saying that for my generation of general nurse students, when we started our education and training, we had no idea about HIV. And by the end of our training and subsequently, it would be inconceivable to run a course without covering HIV, its treatment and prognosis. And I'd used this story to illustrate that we'd written our standards in such a way that they were future-proofed and flexible enough to be able to reflect whatever unknown would emerge for this generation. Of course, we all know from the dates that in no time at all, something previously unknown came over the horizon and changed the world, which was the COVID-19 pandemic. The educationalists, midwives in practice, and the regulators worked together to do their best to make sure the students' education continued, despite the huge difficulties that the pandemic presented. Going back to the foundations of the standards, they are the code and also the framework for quality and maternal and newborn health from the Lancet series on midwifery, which sets the scene for midwifery care for all childbearing women and infants, and for those women and infants with complications. The various elements of this framework appear throughout our standards, and you'll see that it starts along the top line, where it talks about for all childbearing women and infants, and then for childbearing women and infants with complications, and then goes into practice categories, the organisation of care, values, philosophy, and care providers. You could say that this is an expansion of Professor Jane Sandell's birth article in 2012, Every Woman Needs a Midwife and Some Women Need a Doctor Too. And it's also going into Beyond Too Much Too Soon and Too Little Too Late from the Lancet series on maternal health. This is about getting the balance right so that we do the best we can for the women in our care, the women and their newborn infants in our care. The key point in the values is care tailored to the woman's circumstances and need. The philosophy is around optimizing biological, psychological, social, and cultural processes, and crucially, strengthening the woman's own capabilities and being able to personalize care. Following years of development work with the Thought Leadership Group, oversight from Midwifery Panel, and approval from Council, we consulted on the draft standards, and following amendments, we came to the point of having 6 domains. They're all important, but you will notice that domain 2 is about safe and effective midwifery care. And that's about promoting and providing continuity of care and care, as the evidence is clear about the benefits of that to the woman and her infant. Domain 5 includes the management, leadership, and the lifelong learning aspects of midwifery. In promoting excellence, the midwife as colleague, scholar, and leader. And moving into domain 6, that covers the midwife as a skilled practitioner. And you'll recognise the Lancet framework in these 6 domains, particularly the top line in domains 3 and 4, which are about universal care for all women and additional care for those who need it. I'm not going to read, obviously, the 17 themes, but it's worth noting that we have 17 interrelated key themes knitted through the standards. And I often describe them as being rather like the pattern in a jumper. But what I'd draw your attention to is, while evidence-based care is the first bullet point, you'll see that safety comes in as our second bullet point. And it's not just about physical safety. It's psychological safety, social safety, cultural and spiritual safety of women and newborn infants. All of these safety elements, to an extent, are interlinked, and they all link back to respect, kindness, good communication, and tailored, personalised care. All of these are woven into the standards. They're also woven in the sense of being in initial education, ongoing professional development, and revalidation. When we're thinking about physical safety, an example of this is, and this is a bit of a sort of pun nearly, this institute's work on the 7 features of safety in hospital-based maternity units. And that this institute is based in Cambridge and has done work with Bristol around what makes a good, safe maternity unit from the sense of being a hospital-based maternity unit. And what they're saying is that there is commitment to safety and improvement at all levels with everyone involved, technical competence supported by formal training and informal learning, teamwork, cooperation, positive work relationships, and constant reinforcing of safe, ethical, and respectful behaviours. It also takes into account multiple problem sensing systems used as a basis for action, and systems and processes designed for safety and regularly reviewed and optimised. Effective coordination and the ability to mobilise quickly These features appear to have a sort of synergistic character, such that each feature is necessary but not sufficient on its own. The features operate in concert through multiple forms of feedback and amplification. And if you look back at our interrelated themes, you'll see that all of this is in there. The thing about, responding to complications, about mitigating, about interdisciplinary and multi-agency working, and really stressing the importance of the personal responsibility for ongoing learning and development. It's clear that midwives have a vital contribution to the quality and safety of maternity care. And at the beginning of our standards, we have a section on the future midwife, the role and scope of the midwife in the 21st century. And it's worth saying that psychological safety is very important in this space. Psychological safety, in one definition, is that the belief that no one will be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes. An example recently at a conference was around improving psychological safety in the workplace to enable a supportive environment for continuous learning and improvement, so that in the long run your outcomes will improve. Recent work done with this as part of a cycle of quality improvement using PDSA, Plan, Do, Study, Act, a familiar part of healthcare improvement science nowadays for many of us. In the section around the 21st century midwife, we also talk about social safety and social factors, social situations. And social safety is often seen as overlapping with human rights and working to mitigate for the social determinants of health. And it's about respecting people's dignity and their decisions. An example of this is that from the staff survey, the Nuffield Institute's work around cultural safety states that a good safety culture in healthcare is one that includes value and respect for diversity, strong leadership and teamwork, openness to learning, and staff who feel psychologically safe. And that's an environment where each individual feels they will be treated fairly and compassionately if they speak up. So a slightly different slant to what I discussed in the previous slide. But another way of considering it is that cultural safety is about shared respect, shared meaning, and shared knowledge. Spiritual safety is sometimes described as emotional safety. A recent article from Brazil said that the spiritual aspect of healthcare during pregnancy and childbirth can be considered an essential resource in the support of autonomy, security, and importantly, comfort. In addition, it can enable favourable outcomes in childbirth by strengthening the maternal-fetal attachment. The key point in Domain 2 is around providing safe and effective midwifery care. And the evidence is, as I've said, that continuity of carer and care is part of that picture around safety. I've picked out a little bit here about including that the midwife will demonstrate at the point of registration knowledge and understanding of different ways of organising maternity care and the potential positive and negative impact of these on safety and effectiveness of care, because all of us, particularly in management positions, will know how important the way things are organised is to the ongoing safety in a unit. Domain 5 takes us through the leadership elements of midwifery, working with colleagues and building relationships both with the women and the wider maternity care community, both inside and outside of organisations and in community. Understanding human factors is part of this, as is applying the principles of environmental factors and strength-based approaches, and demonstrating of why interdisciplinary working is important. I've mentioned some examples of promoting improvements, quality and safety using safety science, implementation science, and quality and safety research. Evidence given to Parliament on England's maternity safety strategy highlighted the initiatives to address maternity safety and also the timelines for the implementation and embedding the expected impact and the specifics around what was expected in relation to outcomes in that. Improvements were expected around stillbirths, neonatal mortality, maternal mortality, brain injuries and preterm birth. The extensive work included leadership, thinking about things like maternity champions, best practice around saving babies' lives, and maternal medicine networks, plus several learning for improvement initiatives, all coming together to improve maternity safety for the women and infants in England. Domain 6 in the standards pulls all the expected skills together and emphasises the importance of the environment, safety in all its interwoven forms, and about how important it is to recognise the diversity of people's individual circumstances and maximise privacy, dignity, and well-being. This slide takes us through the importance of human factors as highlighted in the standards. And human factors is around the environmental, organisational, and job factors, human individualist and individual characteristics which influence behaviour in a way that can affect health and safety. And the key thing to remember is to put care of people at the heart of what we do, and that we're all about supporting the healthcare professionals on our register to deliver the highest standards of care. Other feedback and involvement of women in the co-production, commenting, and development of the standards was crucial. And in this next slide, the video clip provides clear, simple approach to be used in the community or wherever women receive care, articulating what they can expect from their midwives. And this closes the loop for us with the request from women to feedback around what had happened and where we had got to with the standards and what the key points were.
Let's talk about working with your midwives. Every pregnancy is different. It can be new and exciting, but there's a lot to take in. Everyone needs support along the way. Remember, you're sharing your journey and working in partnership with your midwives. Your NMC registered midwives are skilled professionals who'll be with you every step of the way. They'll get to know you and find out what's important to you and your family, like your physical, social, cultural, spiritual, and mental health needs. Because you deserve a high standard of care, whatever your background. We want you to feel confident about working with your midwives. Did you know they follow our professional code every day? And they study and practice according to our midwifery standards, which are based on the best evidence and designed to promote kind, safe, and effective care. Throughout your pregnancy, your midwives will answer any questions you may have and listen to your concerns. Together, you can make a personal care plan that focuses on your own unique needs and preferences for your pregnancy, and especially for the birth itself. Your midwives will also guide you through all the information that's out there about pregnancy, from planning your baby's arrival to what you can expect in the hours and days after you give birth. If you need someone to explain things in your own language, your midwife can arrange this too. The welfare of you and your baby matters more than anything. That's why only midwives and doctors can look after you during your labour and birth. But student midwives might be there too. This helps them learn how to care for women and babies. They need to do this before they can join our register of all the midwives who can work in the UK. If you or your baby need additional care, your midwives will be there with you. They'll work with other people in the maternity team to make sure you get up-to-date, timely information, support, and care. For most women, this is a special, joyful occasion, but sometimes there's great sadness. Midwives are there to support you and your family, not only in the best of times, but also during the sad times. They'll show you the compassion, kindness, and respect you deserve. Eventually, your health visitor and GP will take over your care. Your midwives will give them all the information they need. We hope you're feeling confident about the care you'll get during your pregnancy, birth, and with your newborn. Why not talk to your midwife about what you've seen in this video? It's a great way to start the conversation.
Thank you. As well as that animation about what to expect from your midwives, we've also produced a series of bite-sized animations to illustrate elements of the code. All of them are available on our website, and some of the ones that may be of interest are around person-centred care, professionalism, delegation, speaking up, but all of them really have a part to play in midwifery as well as in nursing. What I've tried to do on this slide is just to put down some resource examples. The underpinning of the standards we've gone through today, and it's also not the NMC's job to set the curriculum, but we've set the standards with the outcomes that are expected at the end of somebody's education. And as I said, for continuing education and for thinking about revalidation and career development and so on. But when universities are putting together their curriculum, they'll be looking at all sorts of things. And this is where some of these resource examples would be helpful. Around today, we've been hearing lots of interesting information, midwifery conferences, festivals, forums, great sources of information, and what's going on and examples and good practice. There's information available from the professional regulators, the NMC in the UK and the NMBI in Ireland, the professional organisations, again, the RCM in the UK and the INMO in Ireland, Cochrane reviews, known worldwide and very important. And Ireland has its own Cochrane Centre, and we use a lot in the NHS, the evidence base of the National Institute for Health and Care Excellence, or normally known as NICE. There's lots around improvement science, particularly the Institute of Healthcare Improvement, which is now a global movement to improve things in an evidence-based way. And as mentioned before, that this institute, which is the Healthcare Improvement Studies Institute, based in Cambridge, is doing great work within the UK and is including nowadays a midwifery researcher who's doing her PhD as part of their work. And on the global scale, you've the State of the World's Midwifery Networks for improving the quality of care, which is WHO, and other resources such as the ICM. So there are loads of resources and examples that can help to inform anyone who's looking at the standards and getting the big picture, as it were, but then wanting to go and find out a little bit more about things in more detail. I thought I'd finish with a little bit about what we're doing next at the NMC. So we're thinking about how we gain assurance in relation to midwifery programmes meeting our standards. We do that already, but we're wanting to think through whether we can do that better. We're going to have mini campaigns on leadership, listening to women and holistic care coming up in the next sort of 6 months or so, hopefully. And we're building on further work, doing further work on the standards of supervision and assessment of students, and trying to get an animation on that across the line, because I don't think the pandemic helped particularly as we moved from mentoring to the supervision and assessment of students. So it's just about getting that really back on track and making it very clear. We've in the process of doing short video clips for student midwives in each year group, introducing them to the NMC and our standards. And that's really to hopefully go some way down the line of introducing the other aspects of the NMC rather than just focusing on FTP, because we really want to work on removing the fear factor that in some cases remains about the NMC, and focusing on the educational, supportive, and hopefully good work that we're doing around the standards. We're also considering further work on preceptorship, revalidation. There's regulation reform that we're working on at the minute, and in the long term, we'll be reviewing the code to make sure it's up to date. And we're also going to be considering advancing practice across both nursing and midwifery. So thank you very much, everybody, for listening, and happy to take any questions. And I hope that's been informative. Thank you.